So we're going to talk about medications and the older adult. The following are your lesson outcomes. So we know that there are many considerations with the use of drugs in the elderly. What may occur if the uniqueness of older adults is not considered when prescribing medications? Problems related to medications are common in older adults and expensive in terms of both time and money. Medications can alter the older adult's ability to perform normal functions and can result in behavioral changes and can be life-threatening. Adverse drug reactions are common in the older adult. Studies show that as many as 15% or more of hospitalizations of older persons are related to adverse drug reactions, and that about half of these are potentially preventable. In addition, older adults are more likely to develop treatment-related complications or side effects secondary to medications taken during a hospital stay. The greatest risk of adverse drug-related deaths include people over the age of 75, African American men, and people living in extremely rural areas. Adverse drug reactions have also been linked to an increased risk of falls and automobile accidents. On average, people over the age of 65 years of age take 14 or more prescription medications each day. That number jumps to 18 after the age of 80, and this group of older adults consume 40% of all prescription drugs in America. Many older adults prefer to self-treat with over-the-counter medications before consulting with their primary care provider. Studies show that older adults purchase 40% of OTC sold, and that 90% of this group use OTC drugs at least occasionally. Considering these numbers, it's not surprising that use, misuse, and abuse of medications present serious threats to the aging population. Medications are potent substances. For each desired effect, many have side effects and adverse effects that are likely to occur. Medications present risks to people of all ages, and older adults are at even greater risk than the younger population. When a new drug is tested for safe and therapeutic benefits and their dosage established, they often don't take into consideration the unique characteristics of the older adult. Most drug testing is performed on people who are healthier, younger, and have few medical maladies or disease processes. Geropharmacology is the study of how older adults respond to medication. It's new, but a growing area, until all care providers recognize the uniqueness of older adults and modify treatment accordingly over medication is likely to occur. So pharmacokinetics, we talked about several of these terms in pharmacology. Pharmacokinetics is the study of the drug's action within the body. It includes absorption, distribution, metabolism, and excretion. Some factors that we see that affect pharmacokinetics in the elderly include absorption. The effects of aging include a decreased first pass effect caused by reduced liver mass and blood flow. As far as distribution, we see altered storing of fat-soluble drugs in fatty tissues, decreased serum albumin for binding of drugs. As far as metabolism, we see this is altered due to decreased enzyme activity in the liver. And the liver is the primary site of drug metabolism. As far as excretion, we see decreased renal blood flow, decreased glomerular filtration rate, decreased number of functional renal tubules. As the kidneys become less effective in their excretion of drug, more drug remains in circulation, leading to elevated drug levels and symptoms of drug toxicity. As far as absorption goes, most medications are taken orally and are absorbed through the GI tract. Because of a decreased liver mass and blood flow, there is reduced first pass metabolism in the older adult. First pass is the process of the liver inactivating some of the drug before it enters the circulatory system, which can lead to a significant increase in the effects of certain medications like propranolol and labetalol. What class are these? If you said beta blockers, you're correct. Other medications need to be activated by the liver, such as ACE inhibitors. Therefore, the effects of these medications can be reduced in the older adult. Decreased peristalsis can slow the speed in which enteric medications reach the intestine, therefore delaying their onset and action. And changes in the ability of the cells in the GI tract to absorb and transport the drug can further influence its absorption. If medication is not transferred effectively through the cell membrane, the amount of absorption will be decreased. Drug distribution. With aging, there's typically a decrease in total body mass, lean body mass, and total body water, and an increase in total body fat. These changes can significantly alter the distribution of medication. Because there is less total body water, water-soluble drugs such as gentamicin, histamine receptor blockers, and lithium tend to remain in higher concentrations in the bloodstream. This results in increased blood concentration levels of these drugs. An older person who is dehydrated is at even greater risk for reaching excessive blood levels of water-soluble drugs. As muscle mass decreases and the percentage of adipose tissue increases, fat-soluble drugs such as phenobarbital and benzodiazepines become trapped in the fatty tissue, resulting in abnormally low blood levels. If the dosage is increased based on these blood levels, an excessive amount of medication may be administered. Because fat-soluble drugs continue to be released slowly from the fat into the bloodstream, older persons may exhibit delayed or a hangover effect. For example, the half-life of a single dose of diazepam or Valium is 36 hours in a young adult. This may extend to as much as 100 hours in an older individual. A decrease in hemoglobin and the plasma protein albumin are common with aging. This results in fewer available sites for protein-bound drugs such as Coumadin, phenytoin, theophylline, salicylates, and tebutamide. The danger of adverse or toxic reactions is high even with smaller doses because an unbound active drug is still circulating in the bloodstream. The risk for toxicity is greater with malnourished older adults. Older adults who consume high carbohydrate, low protein diets are more likely to develop toxicities than an older adult who consumes a well-balanced diet. Due to these concerns, nursing assessment for symptoms of toxicity become even more important than ever. Drug metabolism. The liver is the primary site of drug metabolism. Aging often results in decreased activity of liver cells, decreased metabolic enzymes, and decreased cardiac output, which results in reduced blood flow to the liver. By age 65, the liver has only 55 to 65% of the blood flow to it as compared with a young adult. This reduction decreases the liver's effectiveness in metabolizing drugs. When drugs are not metabolized effectively by the older adult's liver, the risk of toxicity increases. Toxicity is always a concern with medications commonly prescribed for the older adult, including digoxin, beta blockers, calcium channel blockers, and tricyclic antidepressants. Drug excretion. Aging kidneys are significantly less effective at removing waste products, including the byproducts of medications, as the kidneys become less effective in the excretion of drugs, in part because of reduced renal perfusion. More drug remains in circulation, leading to elevated drug levels and symptoms of drug toxicity. Because the change in kidney function is accompanied by changes in lean body mass, serum creatinine levels often remain constant, masking the decline in function. When the risk for toxicity is assessed, creatinine clearance tests provide a more effective measure of kidney function than does serum creatinine levels. Polypharmacy. Responses to medications are less predictable in the aging person. Changes in target organs may affect the response to medication. Receptor sites on the target organs may respond more or less sensitively to medications. Increased sensitivity to medication places older adults at increased risk for toxic responses. Brain receptors are particularly sensitive, thus older adults typically respond strongly to psychotropic medication. Additionally, receptors may respond in unpredictable ways. For example, the erectile dysfunction medication Viagra began as a cardiac medication. It performed poorly in clinical trials for the intended effect of reducing hypertension and angina, but instead seemed to consistently demonstrate an unusual side effect in the clinical trial participants. Polypharmacy, the use of multiple drugs without regard to interactions and provided by a number of pharmacies without regard to intake of other medications, is a serious concern with the elderly. We talked earlier about the fact that older adults ingest far more medications than do younger people. In addition to OTC medication, herbs, and supplements that may be taken with or without the primary care provider's recommendation or knowledge. The more medications taken, including OTCs, supplements, and herbs, the greater risk for untoward reactions, including drug interactions and drug toxicities. Drug interactions and toxicities in older adults are likely to result in behavioral or cognitive changes, and this may often be mistaken for dementia. Cognitive changes. Last week we talked about cognition. Cognitive and sensory limitations increase the risk for medication errors in older adults. Cognitive problems may include a lack of literacy skills needed to read a label or directions, the inability to understand and comply with directions, and the inability to make correct judgments about medications. In severe cases of cognitive impairment, an older individual may not even recognize that they have to take medications or that they've taken it. If they do attempt to take medications, serious and potentially harmful effects may occur. Cognitively impaired older adults should not be responsible for medicating themselves, but should be supervised by family members or the nurse. Sensory changes, particularly visual and to a lesser extent hearing changes, present problems for older adults. When vision changes, an older adult may be unable to read a medication label or to recognize the different sizes, shapes, or color of their various medications. Many older adults essentially guess what medication they're taking, often taking the wrong medication at the wrong time and in the wrong amount because they're unable to read the label or the directions. Liquid medications, particularly injectable medications such as insulin, are commonly overdosed or underdosed because of poor vision. Many of these risks can be reduced by assessing the person's ability to read labels accurately by proper teaching and by using special labels or magnifying devices that facilitate safe administration. So Mabel is out with her friend Millie and tells her she has some arm pain. Without fully understanding, Mabel states, "I have a wonderful pill that I take to help my pain. Can I give you one?" The intention of helping friends is good, but the consequences may be serious and even fatal. Lack of knowledge about medication can result in serious problems for older adults. This knowledge deficit, which can relate to both prescription and non-prescription medication. The practice of sharing medications is common and persists because many people are unaware of the dangers. They may share in an honest attempt to assist a friend or family member to feel better or out of economic concerns. In pharmacology, we learned about the misconceptions that OTC meds are safe. Why else would I be able to get them in a grocery store? Many older adults have this same misconception. It's estimated that up to 90% of older adults use at least one over-the-counter medication or preparation, In fact, 40% of all over-the-counter medications are consumed by older adults. Many do not think of over-the-counter medications as real drugs because no prescription is needed to purchase them. Because they do not consider over-the-counter medications to be real drugs, older adults are not likely to consult with a physician, pharmacist, or nurse regarding their use. This uneducated use of over-the-counter drugs can be hazardous to older adults, particularly those taking prescription medications. OTC medications are capable of potentiating or interfering with prescription medications, possibly resulting in serious harm. Over-the-counter drugs can also create or mask symptoms of disease. Use of these drugs can make it difficult for the primary care provider to recognize these changes in the health status. Older adults must be taught to consult with their primary care provider or pharmacist before taking any over-the-counter medications and to carefully keep track of and inform their primary care provider of all prescriptions, over-the-counter medication, herbs, and supplements that they take. Alcohol. This is the most commonly consumed non-prescription drug used by adults. Many older adults do not think of alcohol as a drug, so they don't consider it when taking medications. Alcohol can cause adverse reactions when taken in conjunction with many prescription and over-the-counter drugs. Today, most prescription drugs are labeled if there is a risk of interaction with alcohol, but these labels are not always given adequate attention. Older adults often lack adequate knowledge regarding their prescription medication. It's not uncommon during a healthcare stay for medications to be changed several times before discharge. At discharge, the patient is often given one or more prescriptions and simply told to take them according to the directions. The directions provided may be very clear to the healthcare provider, but they may be easily misinterpreted by older adults. Even simple misunderstandings can lead to improper self-medication, which leads to serious consequences. To reduce the risk, older adults often require additional instruction to take their medications safely. We all do it. We have an infection, we feel better after a few days, so we stop taking the antibiotic and save it for the next time we don't feel so good. Saving old medications also increases the risk for problems if the older person thinks the drug is appropriate and takes it without checking with a physician. Medications are expensive. A single prescription can easily cost $100 or more a month. If the aging person requires more than one medication, the cumulative costs can be overwhelming. To save money, older adults living on limited incomes may fail to take their medication, or they may change the amount or frequency to conserve their supply. My father-in-law is a wonderful example of this. He cuts his Lipitor in half one day, so he takes 15 milligrams, and the next day he takes the full dose of 30. Because these changes do not follow the recommended therapeutic schedule, a wide variety of unexpected responses can occur. Even with insurance coverage, some prescriptions may not be filled. Older adults may say, "I don't like to take that pill." Others will get a prescription, fill it once to see whether it's worth the price. If the benefits gained from taking the medications are not readily obvious, the older adult may not fill the prescription. Because medications are expensive, many frugal older adults save medications that are prescribed in the past, even if the drug is no longer part of their therapy. Older adults are often reluctant to discard costly medications, holding on to them just in case they're needed again. This practice can bring serious harm if the medication becomes outdated. Outdated medications can undergo chemical changes that make them hazardous. Nitroglycerin is an example. Saving old medications also increases the risk for problems with the older adult, thinking the drug is appropriate and taking it without checking with the primary care physician. Safe drug administration begins with a thorough knowledge and understanding of each medication. Clarifying and resolving any questions regarding medication therapy before administering a medication. Information regarding medications is contained in many reference books, which should be readily available to the nurse. Before administering medications, the nurse should be aware of the following. Thoroughly assess the older adult before administering any medications. After administration, monitor the older adult continually to determine whether or not the medication is having the desired effect. Perform this after administering both scheduled and as-need medications. Also observe for any untoward effects or significant changes in medical condition or behavior. Because normal physiological changes and the effects of disease place the older person at an increased risk for drug-related problems, be particularly watchful for any signs of overdose or toxicity. So the following is an acronym for medical assessment. C for caution or compliance. Assess benefits and risks. Remember, there are many reasons an older adult may not be compliant. A, adjust. The dose may be changed based on age and condition. Start low, go slow is the rule for older adults. A little goes a long way. R, review regime regularly. Polypharmacy is common in older adults. Each new medication increases the risk for interactions. And E, for educate. Be sure the older adult knows their drugs, how and when to take them, and when to notify the primary care provider. So on Evolve, there is a handout regarding common drug categories with precautions related to aging. Please see this handout. Medications are only one part of the overall care of the older person. Nursing interventions and precautions related to medication should be addressed in the care plan. This should include the use of safety devices, call signals, behavior monitoring, or any other specific precautions related to medications. The plan should include when it is necessary to check vital signs, monitor laboratory values, or make any other special observations. Their care plan should indicate any individual preferences of the older adult. Many older adults use a particular order or method for taking their medications. This information should be in the care plan so that all staff nurses could be consistent. We've addressed the use of the 6 rights in the administration of medications in several classes. It's often necessary to modify procedures and techniques of medication administration when working with older adults. Despite modifications, the traditional rights of medication administration remain essential to the process. How have you seen the patient identified ×2 in the long-term care facility? Older adults have the right to know what medications they are receiving and why they are receiving them. Nurses should provide this information when questioned and when a new medication is prescribed. Older adults also have the right to refuse to take medications. If a person refuses to take medications, the nurse cannot use force. A positive attitude and encouragement may help encourage the individual to cooperate. However, when a medication is still refused, you must determine and document the reason for refusal. Notify the nurse in charge and communicate any problems with the primary care provider. Provide privacy for the older person during injections or any other procedures. Close the door and curtain. Failing to do so is a violation of resident rights. What do you think about the practice of administering medications in the dining room, or providing an injection or even a blood sugar out in public? Administering psychotropic drugs as chemical restraints present a risk to the rights of an older adult. You must follow specific guidelines carefully regarding the administration and monitoring of behaviors when the older adult is receiving a psychotropic medication. Each abnormal behavior that is an indication for administration must be individually identified in the plan of care. During each shift, you must document the number of times these identified behaviors occur. If no symptoms occur in a given dosage at a given dosage of psychotropic medication, the prescriber may attempt to decrease the dose. This process continues as long as the older person receives these medications. One of the situations we ran into in Jerseyville was a competent young resident in his late 50s who had a bottle and a half of ZzzQuil, a Benadryl sleep aid, in his room. Is this allowed? What are the ramifications of this, considering that it contains alcohol and the patient drinking it? Under OBRA legislation, residents of care facilities should have the option to self-medicate if they are capable of doing so safely. An order stating that self-medication is permitted is usually required. We want to assess prior to allowing self-administration, determine if the patient is safe to administer, understands and complies with the medication regime, can read the label, follow directions, and measure the dose accurately. The nurse must then develop a plan to include delivery of an adequate amount of medication, safe storage of the medication. Will it be kept at bedside? How is it kept away from other residents? Record keeping of medications taken and follow-up assessments of medications, effectiveness or side effects. Please refer to box 7-3 on page 143. Noncompliance with prescribed medication is common among older adults. Choosing to not take medication as prescribed can result in poorer health, adverse reactions, emergency department visits, hospitalizations, and even death. The financial cost of non-adherence with medication therapy is estimated to be as high as $100 billion a year. Several factors can increase the risk of noncompliance. Cognitive and sensory limitations increase the risk of medication errors. Keeping track of multiple medications can be confusing to anyone, but is more likely to present problems for older adults. One or two medications do not seem to cause many problems, but a significant number of older adults become confused and non-adherent when 3 or more medications are ordered. Special precautions and complicated time schedules compound the problem. Techniques that improve safety and adherence include, but are not limited to, the following: associating medication schedules with regular daily events, such as meals or bedtimes; ensuring that containers are properly labeled with large, uppercase, dark, or bold lettering; applying color-coded tapes, stripes, pictures, or textures such as sandpaper to containers to help the older adult recognize them. For example, black could indicate medications to be taken at breakfast, red could indicate medications for lunch, and a piece of sandpaper attached to a bottle could indicate a bedtime medication. You should avoid yellow because many older adults have difficulty distinguishing this color from others. Modify containers for ease of use and ability to open. You are able to get non-child-proof lids from a pharmacy. Establish measures to distinguish and separate similar containers. If the older person is receiving eardrops and eye drops, store these containers well away from each other and mark clearly with a large picture of an eye or an ear so that they are distinguishable. Teach older adults to store medication properly. For example, away from direct light and moisture, which could cause significant chemical change. Nitro is an example. Obtain or devise a system to promote adherence, such as medication reminder systems. And stress the importance of being alert when taking medications. Sleepiness can interfere with the ability to read labels. If the patient is not completely awake, they can easily take the wrong medication. It's not advisable for the older adult to keep any medication, particularly those taken to promote sleep, at the bedside.